they may not be able to perform as well because of this discomfort and symptoms to run to the toilet. And so, if you have known of people with IBS, there would normally be a recommendation on the dietary and lifestyle that they can have to actually minimize, reduce their discomforts and symptoms. So I'm going to share with you on that. And the first one is focus on low FODMAP diet. So what does FODMAP means? It means the different forms of your sugar molecules. So these are the sugar molecules that you can find. The carbohydrates, it is to reduce refined sugar in your diet because these sugars are actually non-digestible short-chain carbohydrates that would actually cause the bloating effect in your tummy as well. So I believe like majority would have a reduced intake of like dairy products, milk. Wheat is also a culprit, so try not to have just white bread. If you want to have your bread as a staple, go for your wholemeal or whole grain, multi-grains of the bread. And then just as much as possible, please avoid like sweeteners. The last point that we mentioned here in the slides, in some of the products that is more processed and manufactured in that sense. So always go for fresh ingredients, that would be the best. And besides staying on low FODMAP diet, it is not to actually totally remove carbohydrates from your diet. It means just a reduce in carbohydrates and the selection of complex carbohydrates into your diet as well. And then the other one that you can focus is the Mediterranean diet, where they have emphasis on your good fats, healthy fats, lean proteins. So for this diet pyramid, it is much more easier to achieve in the sense that you can include your grains, compact grains, and then you can still have your meat, your proteins, your fats, your oils, and then fresh herbs or spices. The best beverages would still be water to keep yourself hydrated. Reduce on caffeine drinks if you can, like coffee, tea. Of course, not to say the favorites among many Singaporeans, your bubble tea, right? So please, if let's say you have a sensitive gut, intestine, you will want to go slow on this caffeine, refined sugars in your diet. And then what you can eat, if let's say you are having this acute IBS phase, these are the fruits, the nuts and seeds that you can have. Nuts and seeds, please just stick it to 10 to 15 pieces would do, not too much. So all nuts and seeds, except pistachios and cashews, they are high in FODMAP. Your fruits, go for your berries. Love your berries, like for example, blueberries, strawberries, raspberries, and then some of the citrus one, your lemon, your kiwi, your lime. For dairy products, go for lactose-free so that it doesn't give you the time to run to a toilet as well. Hard cheese is also possible. Vegetables, most of the vegetables, they are fine. So it's also to include variety in portion at the regular timing. So what do I mean by that? You can then focus on mindful eating. So when you do mindful eating, right, you basically know what you're eating and you basically enjoy what you're eating. So when you eat, you focus on your meal. Do not be engaged on your social media, on your handphones. But if you're eating with friends, colleagues, then it is a good time to actually focus on social interactions. And then to also eat at the pace please chew your food before swallowing. That is important. That is also a kickstart for the very initial digestion to take place. Then, have a happy mood when you eat it. Give yourself at least 20 minutes to half an hour to finish a meal. So the portion of the meal matters. I would say you can stick to the quarter half rule, where you have quarter of your good carbohydrates, quarter of your lean proteins, your healthy fats, and lots of vegetables and the fruits that we've mentioned earlier on. Hydrate enough water because the body needs the good fluid to actually move your circulation as well. So you can then actually focus on mindful eating if you have not done so in the past. Maybe then that would actually encourage you to love your food and to eat well. Then for the exercises, what you can do. For a lot of IBS patients, right, they are really very anxious. They do not have a good breathing technique, I would say. Their breathing are usually very short because they are very kanchong. They are very worried, like when is the next attack coming in? And then, oh no, I feel that I need to run to the toilet. So at events like that, you can look at the last picture here. It actually focus more on mindful breathing. Okay, so the second mindfulness. Mindful breathing is actually using your abdominal to breathe well. After you find the right position to breathe well through your abdomen, that means when you breathe in, your abdomen actually balloons out, then you can focus on the rhythm of your pace of breathing in, your inhale, and your exhale. So the inhale, you can go for 5 counts, hold your breath for 3 seconds, and then exhale an 8 count. So by doing so, when you pace your breathing and you breathe right, it helps your body to calm down, to engage and encourage more on the parasympathetic activities in the body, which means to digest better, to rest and to recover, to calm anxiety. Go for nature walks. Be with your greens and maybe some of the beaches, reservoirs, take in fresh air so that your body get refreshed in that sense. Your mental, mind, emotional feels better. And when that happens, physically, there will be improvements to your symptoms as well. Some of the quiet form of exercises that you can explore would be your yin yoga. Yin yoga focuses much more on stretches exercises and also breathing techniques when you're doing that. So you can focus maybe in a week to do 2 to 3 times, each time about 20 to 30 minutes. When we want to, have a change in our dietary and lifestyle, we try to keep a routine to it. So a good routine, and when you establish it, we can actually review your symptoms in 3 to 6 months' time. So on this slide, please remember mindful eating, number 1. Number 2, mindful breathing. Number 3, go for your nature walks. Number 4, in yoga, stretches, exercises with good breathing techniques. Okay, so having said of what you can do to help minimize, reduce IBS discomfort, then we go on to actually explain in the TCM context what is IBS all about, what are the common constitutions that we see clinically, and how TCM actually help to manage IBS to reduce the discomforts. So in TCM explanation, right, this discomfort, we actually name it like, for example, abdominal bloating, diarrhea. They are obvious symptoms that we would normally observe in IBS patients. It is the interaction between the shen, which is the mind, and the digestive organs. This would actually have a very great link to the explanation on the brain and gut axis. So then, the stomach and spleen are actually the part of the digestive organs, which are responsible to break down and transform food sources to nutrients for energy uptake and nourishment for the whole body. That is not enough because what we intake, the input, there must also be an output to it. So the output would be from your small and large intestines to actually remove the waste and toxin out of the body. So when digestions to be taken place effectively, these two must be achieved. So for IBS patients, right, they may not be able to digest well because of the disharmony in your qi movement between the digestive organs. And also they may not be able to excrete waste as effectively as well. So their stool are more probably alternating between hard stool, between stool, or a mix. The common constitution that we see in the clinic would be first, liver stagnation and spleen deficiency. Second is the spleen and kidney yang deficiency. So these two, for the first, we actually look on circulation. This group of people, they would have very obvious anxiety, behavioral, worrisome, and they are not eating well. They may skip their meals at times. So for this particular group of constitution, what we want to do in clinical is actually to readjust, to realign the liver qi movements in the body, so that when it is more well done, when the patient is more relaxed, for example, to increase their vagal tone and also their digestive function, then better digestion and assimilation would take place in their body. So they can feel that there would actually be a reduction of like the discomfort symptoms in their body. The second one, like spleen and kidney yang deficiency, mainly because it is a yang deficiency, we can see that their complexion colors are not very well. They are afraid of cold, and the bloating issues is very obvious to them. Their stool can be loose. So their energy per se, like for example, they would feel more lethargic, tired, not too much motivation to move around. So this we have to activate to strengthen their energy levels in the body, to keep them warm, so that likewise effective digestion takes place, reduce anxiety and anxious feeling, so that all this the discomfort of IBS can be reduced. And so over here at EMW, what we would do is that we would have acupuncture and moxibustion. So acupuncture and moxibustion are suitable for majority of the constitution. And what it does through the treatment is that it encourages the parasympathetic system, which is to allow the body to rest, to digest, recover. Basically, it means no fighting in the body. So we want to reduce the fighting, the fight and flight mode in the body. And then it regulates neurotransmitter and hormonal chemicals in the body, like serotonin, to reduce anxiety. So when that happens, it actually calms and soothes the spastic intestine. So what I feel, or the takeaway that I would have in clinics is that they come here, they may have a very heightened anxious level. You can feel it, you can actually, when you ask about their symptoms, you look at their tongue, you feel their pulse. They are basically very worried about the issues that they are facing, about the symptoms that they have to manage on a day-to-day basis. And then once they actually calm down, relax before we start the treatment, and after 20 minutes or 30 minutes of treatment, they find themselves in a more relaxed and calm state. So to me, that would be actually, treatment objective achieved, a take on it. And when we actually look into this, we are looking at a long-term management for IBS symptoms. There will be good and bad times. Okay, so what we want to achieve is that we want as much as possible for your body, the initiation of your own body healing to take place so that it can be able to manage the discomfort through your lifestyle, through your dietary, through the wholesome, good emotional when you take care of it, so that you reduce the frequency of your IBS attacks. That's number one, reduce frequency. The second one is, even though that would be that attack, it shouldn't be that severe. The second point is that besides acupuncture and moxibustion, we also do prescribe customized TCM herbs according to your constitution. These herbs actually helps to enhance digestive function, then to regulate bowel movements, and to reduce the discomfort of like the abdominal bloating and pain. So I've stayed down below the references that you can actually read up if you are keen on the studies that have been made by this, both like acupuncture, moxibustion, and the traditional Chinese medicine, on how they can complement and help for IBS patients. And then the last but not least is a bonus. It's a bonus because this is what we do at EMW. We believe in a more holistic approach that we can actually complement other aspects into our treatments as well. So I'm also a certified aromatherapist. I have been an oil user for at least 2.5 years for now. I have seen great improvements if, let's say, we would to introduce oils into our treatments. Like, for example, the oils, we put it for acupressure massage. It is better than just doing the acupressure massage alone, on its own, because oils itself, they have the chemical properties, there are active ingredients in it to actually helps, for example, like ginger and peppermint, to reduce the bloating and to relieve abdominal spasm for IBS patients. So we can have a oil blend with the ingredients above. If you are oil user, you can actually consider this to actually introduce ginger, peppermint, bergamot, and Roman chamomile, and dilute this oil in carrier oil before doing before applying on your tummy and doing tummy acupressure massage. If you need to, this can be done twice a day or on a daily basis based on the dilution of this oil. So in our clinic, what we would do for patients is that we would actually have oils for our patients with acupressure before we move on to do acupuncture and moxibustion. So I hope there would be some good takeaway from the sharing today on like what you need to know about IBS, what kind of diet is suitable, what you can do on your own to help manage or reduce IBS symptoms and discomfort. So remember the two mindfulness and the exercises, mindful eating, and the 2 kinds of diet that I've introduced earlier on. Low FODMAP diet, which means to reduce carbohydrates in your diet, and to introduce Mediterranean diet, which means to introduce good fats, healthy oils, lean proteins, fruits and vegetables, and then in portion at regular timings for your breakfast, lunch, dinner. And then to have mindful breathing, to pace yourself, to reduce anxious emotions, and then to have more active, walks outdoor, and then to practice some yin yoga to regulate better emotional, mental well-being in the body. Okay, so that's all for my sharing today. Thank you for tuning in, and I hope to see you again.
stop sharing.